Hey, Mom. This is Sam, my social worker. He coordinates the next steps in my treatment plan.
Hello, Sam. Glad to meet you. Did the doctor mention when Paul is expected to be discharged?
The doctor said that he should be ready to go home sometime in the next few days. Paul asked that we include you in today's meeting as we will be reviewing treatment options once he is ready to go home. Paul, you will need to continue treatment as an outpatient, and we believe you may benefit from additional programs available in the community.
Do you have any suggestions or information about where we could continue his treatment?
Absolutely. Let's review the options together. Understanding all the available options can help individuals, families, and treatment providers make the most informed decision when choosing which services to seek out. There are different levels of care depending on each person's needs, including acute inpatient units, crisis centers, partial hospitalization programs, intensive outpatient programs, and traditional outpatient services. Each level of care can be a place to receive treatment for mental health symptoms and diagnosis. To review a comprehensive list of all the services available, let's begin with acute inpatient, which is the highest level of care. It is typically located in a hospital or in a specialized unit, such as a residential treatment center. The main goal of inpatient treatment is to stabilize symptoms while developing a continuing treatment plan in a less intensive setting. Crisis centers are not available in all communities. They are designed to provide immediate care to anyone experiencing a mental health crisis. These centers provide 24/7 monitoring and medical treatment and also help patients avoid the hospital emergency room setting. Crisis centers focus on identifying the cause of the crisis and then seek appropriate treatment facilities to continue patient care. Partial hospitalization programs, also called PHPs, are a type of outpatient program that allow individuals to remain at home. PHPs often include a medical monitoring or medication management component. Intensive outpatient programs, or IOPs, are another level of care for people who don't require hospitalization but need a higher level of care than traditional outpatient treatment. These programs provide services that take place mostly in a group setting. The focus is typically on stabilization and symptom reduction. These programs are less structured and intensive than partial hospitalization programs. Traditional mental health outpatient programs are increasingly common treatment settings. They typically involve visiting a psychiatrist or other mental health professional for therapy and/or medication management. These services can be tailored to an individual's specific needs and adapted to their personal phase of recovery. They can include individual therapy, group therapy, family therapy, and couples therapy. A client can receive these services weekly, bi-weekly, monthly, or quarterly. They can be provided in a private practice setting, at a larger private provider, or at a community mental health center.
Thank you very much, Sam, for explaining all the various programs available in our community. I would have never known that so many resources are available.
You are very welcome. I would like to ensure Paul continues his treatment once he is discharged. If I can provide any further support as you both search for an outpatient center for his care, please let me know.
Thank you. I'll take your advice to look online and find local programs available to support my son during his recovery journey.